and let's take a look at the number of cases. India has crossed 12,000 COVID-19 cases, 941 new cases reported in the last 24 hours and 37 deaths. 1,489 recoveries have taken place till now. So India there crossing that 12,000 mark. Now, India's districts will be classified into three categories. That's hotspot districts, which report a large number of positive cases. Remember, these are the districts that won't see any sort of relaxations after the 20th of April. Non-hotspot districts, which record a few coronavirus cases. And then the green zones, which have not reported fresh cases for some time. So let's take a look at how it looks for various parts of the country. Now, Delhi, the capital, if we talk about two-thirds of districts fit the category of red zone districts, as they have more than 15 cases. In Andhra Pradesh, a little over 56% are red zone level districts. There is no district, however, with 0 cases. Tamil Nadu, which has a total of over 1,200 cases, a little over 40% are the red zone level. There's no district with 0 cases. Rajasthan, a quarter of the districts fit the red zone criteria, and Maharashtra has the most number of cases, rapidly headed to the 3,000 mark, but just about a fifth or 22% of districts are at the red zone level. So let's compare the new cases. The states with the most cases are Maharashtra, Delhi and Tamil Nadu. To get a sense of where these states are headed, NDTV's data team crunched the numbers and compared it with the latest All India average growth rate. Earlier, Maharashtra shot up by 350 in a 24-hour period, almost a third of the 1,118 cases that were reported. Now this graph shows that while India's current average growth rate is 11%, Maharashtra and Delhi are both higher at 15 and 14%. However, take a look now at Tamil Nadu, which has the third highest number of cases. Its average growth at 8% is significantly lower than the national average. So let's go across to our reporters. We're joined by Sukirti from Delhi and Sam joins us from Chennai. Sukirti, first to you. The numbers now crossing 12,000 and in Delhi we're seeing a very high rate of growth.
The numbers, if we look at the cumulative numbers in Delhi, the figure has crossed the 1,500 mark in Delhi in terms number of total cases. But if we look at the number of cases that we are seeing every 24 hours, we've been seeing varying figures. Just on 2 days ago, we saw 356 cases within a span of 24 hours. That was the sharpest single day rise that Delhi saw. Then we saw 51 new cases the next day, and yesterday we saw 17 new cases. But could we say that just because yesterday we registered 17 cases, the number of cases in Delhi is low? Then the answer would be no, because the numbers keep on varying in terms of how many number of people have been tested on that particular day. As far as the total numbers are concerned, they have been increasing constantly, gone beyond the 1,500 mark. The total number of deaths stand at 32 right now. And also in terms of containment zones, which reflects the spread of the disease, Delhi currently has 57 containment zones. 2 of them were added yesterday, some of the blocks in Model Town, as well as a block in Safdarjung enclave area of South Delhi. So as far as the number of cases increasing is concerned, so far Delhi has not seen any of the cases go lower, whether it's in terms of containment zones or the way cases have been increasing in the national capital.
All right, well, let's go across to Sam now. And Sam, what's the situation in Tamil Nadu? It's the third state with the highest number of cases. And what has the rate been over the last couple of days?
Well, officials look at the declining numbers over the last 2 days as the first indication of the state actually going down in terms of the positive cases. Gargi. Yesterday, 38 people had tested positive. The day before, 31. Over the last 10 days, the average was around 90, some days more than 100. So in that sense, officials say this is a welcome step. They are waiting for today's numbers to be able to draw the larger picture. But the worrying factor is, Gargi, 22 districts of the 34 with positive cases have been declared as hotspot. This includes Chennai, Salem, Coimbatore and many other districts, and that's the big worry. But officials say they've deployed more than 30,000 people on all these areas, declaring 538 areas as containment zones, and their job is to go door to door, check for symptoms, isolate people at home or in the hospital, send them for testing. That way they hope this kind of the spread of virus could be checked and these numbers could further continue to decline. But the bigger worry is that the state government has not ramped up its testing yet, Gargi, although the state has highest number of testing labs with the capacity to test around 5,200 cases every day. They're only having it around 2,500 tests done every day at the maximum. And many are questioning why can't we put the testing facilities to good use so that more number of people could be tested, more lives can be saved. Officials say they still stick to the guidelines given by ICMR, which is on the basis of clear symptoms like cold, cough, fever, nasal congestion and respiratory issues. At the moment, only 7,835 people have been tested. The mortality rate, the government says, is only 1.1%. Unfortunately, the rapid test kits have not arrived in Tamil Nadu yet. That's a big worry. The consignment, officials say, has been diverted to US by China. They're waiting for the next consignment to arrive in the coming few days, and that's a big. But at the same time, the government is also ramping up its isolation spaces across the state. They have 29,000 isolation beds across the state and more than 3,000 ventilators ready. But the big question, will the declining trend continue? Will the state be able to flatten the curve?